Hello, my name is Laura Clarizio, and for my viral presentation, I will be discussing the Epstein-Barr virus. So here's an outline of what I'll be discussing. First, I'd like to talk about the virus and the viral genome. Then I will lead into what diseases are caused by the Epstein-Barr virus, how the virus is transmitted, and then the reservoir for how the virus is spread. And then I will be talking about patient presentation and symptoms and possible treatments for the Epstein-Barr virus. The Epstein-Barr virus is a member of the herpes viridae family of viruses. It's known as human herpes virus number 4, or HHV4. It's one of the 8 known viruses in the herpes family. It shares a common structure with other herpes viruses such as HSV1, which is herpes simplex virus 1, also known as oral herpes. HSV2 is herpes simplex virus number 2, or the genital form of the virus, and then varicella is similar in structure, and that causes the chickenpox and shingles. The Epstein-Barr virus is extremely widespread among humans. It is thought that 90% of adults have evidence of a previous infection with the virus, and the latent form of the virus remains in most people, meaning that the virus is persistent in the body for the life of the host, and it lies dormant. Some of the viruses may reactivate at some point. Things like varicella and shingles and the herpes simplex virus 1 and 2. Here's the viral genome. All herpes viruses share the same common structure. There's a picture on the right side of the structure of the herpes virus. It's a large and complex structure. It's double-stranded and containing DNA. Its target is in the host, the cell of the human. It's the epithelial cell or the lymphatic cell, which is the B cells. Here are some diseases that are caused by the Epstein-Barr virus. First, the best known cause is that of infectious mononucleosis, or mono. Other associated diseases that are caused by the Epstein-Barr virus can be certain types of cancers. It's thought that 200,000 cancer cases are attributed to the Epstein-Barr virus per year. Some of those cancers are Hodgkin's lymphoma. It's thought that 1/2 of cases of Hodgkin's are due to the Epstein-Barr virus. There's also Burkitt's lymphoma, gastric cancer, and nasopharyngeal carcinoma. The Epstein-Barr virus is also associated with conditions related to HIV. There's hairy leukoplakia, which are white patches that develop on the tongue in those that are immunocompromised. Sometimes that can be a telltale sign of HIV or AIDS, are these white patches. It's also thought that the Epstein-Barr virus is also associated with higher incidences of some known autoimmune diseases, such as rheumatoid arthritis, multiple sclerosis, and possible lupus. The Epstein-Barr virus transmission, it's most commonly and easily transmitted through saliva. It's been referred to for a long time as the kissing disease. It's spread through saliva on cups and eating utensils, forks, spoons, toothbrushes, children's toys, the saliva on the children's toys, It can be also spread, though more rarely, through other bodily fluids such as blood or semen through sexual contact, also through blood transfusions and organ transplantations. This is the reservoir for the Epstein-Barr virus. It's more than 90%, as said before, of healthy, previously infected people carry the virus for life. The virus will be found in their saliva. Humans are considered the major reservoir for latent Epstein-Barr virus infections. It enters the body via oropharyngeal epithelial cells and the B cells, and which then they migrate through the body through the lymphatic system and cause symptoms that will be shown in the next couple slides. So you could see a picture on the right where the Epstein-Barr virus is transmitted in the nasal passageway, infects the epithelial cells, travels through the lymphatic system. On the bottom right, you could see that there's latent infection memory B cells, which are, memory cells that are long-lived, and they escape cytotoxic T cells. So therefore the presence, because of these memory cells, of the Epstein-Barr virus in the body is lifelong. These are some patient presentation, how the patient might present their symptoms. On the left side is the subjective, what the patient might be feeling, and on the right side is what objective findings, what the provider might find in the patient. So on the left side, the patient might be complaining of fever, chills. The patient might complain of headache. Fatigue is a big one. Sore throat is a big one. They might have like pus or redness in the back of the throat. Shortness of breath and cough is rare. Anorexia, they have a sore throat. They don't feel like eating, and severe body aches. And then findings on the right are fever in children and teenagers. It can be high as 102.5 degrees Fahrenheit. They have swollen lymph nodes in the neck, and patients might have an enlarged spleen. It's thought that 60% of individuals with Epstein-Barr virus or infectious mononucleosis have an enlarged spleen or splenomegaly, and the concern is that it may rupture. It's pretty rare, but it's only 2 in 1,000, but there is a concern about that. There is an inflamed throat, obviously. There's tonsil enlargement and exudate. There might be gray or white pus in the back of the throat. On rare is swollen liver. If it's not swollen or enlarged, it could be just tender to touch. And rare, again, is a rash across the trunk and the arms. So here's a picture of some of the symptoms that a patient can have for infectious mononucleosis or from the Epstein-Barr virus. So you could see it's a pretty systemic, kind of infects all the systems of the body. Patients often look a lot sicker than this guy, but a lot of signs and symptoms. Treatments, there's no vaccine that's provided to prevent or protect against the Epstein-Barr virus. There's no specific antiviral treatments that are available, such as acyclovir, that is not recommended to treat infectious mononucleosis. Supportive and symptom treatment is really recommended. You obviously want to perform proper hand washing and prevent the spread to others through, the saliva. You want to prevent, avoid drinking out of other people's cups, eating utensils, don't use each other's toothbrushes. You want to stay hydrated, increase your fluid intake, drink plenty of water, probably 1 to 2 liters per day. You want to get plenty of rest. Patients are often offered analgesics such as Tylenol, acetaminophen, or NSAIDs such as ibuprofen for fever, body aches, malaise. They really are pretty sick and don't feel good. And then symptoms sometimes such as fever may last a few weeks. People need to know that. And fatigue may last weeks to months, and their energy levels are really going to be down for quite a while. And then follow-up, contact sports in school-age children should be avoided for at least 4 weeks until they, get their energy up. And then the thought is if they were to get hit, they want to avoid that spleen is going to be enlarged, and they don't, they want to avoid it to rupture. And then avoid alcohol for at least 3 months until liver function tests return to normal. Patients should be followed up by their provider to rule out the development of serious complications. There's a lot of things that can happen from the Epstein-Barr virus and infectious mononucleosis. It can kind of affect all the body systems. Guillain-Barré is a neurological disorder, meningitis. It can cause hemolytic anemias, myocarditis, and affect the kidneys, glomerulonephritis. So they need to follow up and make sure, they're getting better and not worse. And that's my presentation on the Epstein-Barr virus. Thank you.